Hi, Claire.
Hi. Oh, you can hear me too.
Yep, I can. Before we get started, is there anybody who still does not have access to the book? Do we have anyone who still doesn't have access to the book? Let me ask this question because I know she didn't have access. Brittany, do you have access to the book?
Yes.
Awesome. Okay, awesome. Anyone else who doesn't have access to the book? I'm not sure. I've gotten a lot of emails recently about not being able to get into the class the first day. Was there anyone who couldn't get in that first day? I know it was more in my earlier class today, but is there anyone? Most of you, I think, were here on Tuesday.
I have a question.
Go for it.
Okay. So, I just want to be clear that like the homework that we do is all the 30 questions for chapter 1. Because it appears that I got like a 10 out of 10 on it.
Okay.
Is that,
Yep.
and then there's something that says exercises. Are those the exercises?
Say it one more time.
Oh wait, maybe I'm confusing you with I think I'm confusing you with the other class, and then I figured it out. Let me see really quick. So do we start doing the questions that go along with the book for a grade?
For the smart book?
Yes.
Yes.
Okay. All right. I finished the chapter 1 and then the question. So I was just curious. And then there's like 2 other things. There's something called like practice and then chapter 1 quiz, which I didn't want to do yet until after this class.
You could start doing the chapter 1 practice right now.
Okay.
I wouldn't do the chapter 1 quiz until we're done with this chapter and lecture.
Okay.
Progress.
But the practice quiz, the chapter practice, you can do over and over and over again.
Okay.
And that's
also
the smart book, right? Or no?
No, that's different. So there's a smart book assignment and then there's a chapter practice.
Okay. I think I did the smart book last night.
If you give me 1 minute to stop sharing, I'll tell you. Give me 1 second here.
Okay.
One second here. Don't fight with my cord. Don't play with my cord, baby. I have a kitten here, so just bear with me here as I'm working with my table and he wants to play with my computer cord. Caitlin, yes, you did do the smart book.
So, okay, so that's different from the practice, correct?
Yes, it is.
Okay,
Please,
I'll
Teacher-
show you, I'll show you in 1 second the difference.
okay. I just
Where-
wanted to make sure. I know I did something last night and I wasn't sure if it was the same or if it was different.
Was there another question?
Where do we find this?
my question is, when I was
Oh,
trying
okay, I
to
think
do,
I've got 2 questions. Tony, excuse me, Toya, wait for 1 moment, all right? Who else
Okay.
was asking the question?
Where do we find the smart book assignments?
I'll show you in 1 second. Toya, what was your question?
yesterday when I was trying to do the chapter 1 practice, so I got to some points which it said we should like join the answer together or whatever. So I don't get it. I don't know how
Did it
to
say
do
it
that.
again? What did it say?
Like we should connect the answer, like put the answer somewhere.
Can you
So I-
draw, can you put your mouse over the top of it and drag it?
Yeah, it says I should drag it, but I was using iPad, so I was unable to do it.
Can you use a different computer, Toya?
Okay, I'll try that today.
I'm sorry. You have to be able to do that and it's for lecture, it's for your exams and your practice and your quiz. Would you be able to do that? Okay. All right, and someone, where do you find that smart book assignment in that chapter practice? Is that what I would? Who was it who was asking that?
Me, Brittany.
Brittany, I'm gonna ask you to do me a favor, 1 second here. Can you? Share your screen? So if you go to Brightspace, go to our class. And then go down to week 8:30 back. Yeah, right there. Okay, that first one, that chapter 1 major themes,
Mhm.
that's a smart book assignment. So click launch. Begin.
Yeah, I was doing the questions. But
Okay.
I didn't, that was what you were talking about.
That is that smart book assignment. So it's going to ask you a series of questions and you can either just continue with the questions or read some of the textbook and then answer the questions.
Okay, yeah, I read the whole chapter. I just didn't know. Okay, so now I understand. Thank you.
Okay, you're welcome. The-
Is this, I'm sorry, is this
Go-
the same assignment we have?
Say it again.
The smart book assignment, is that the assignment we have to submit?
I'm sorry, say it 1 more time.
I said, is that the assignment we are to submit?
Yeah, well, you're gonna do that and you're gonna do the practice.
Okay.
So Brittany, go back. You know what? Let me share my screen. Sorry. Oh, I don't want you to see this. Shoot. Just a second. 1 second. There. Okay. Close that out. So right here, you're going to submit this. So this is a smart book assignment. This is the practice. And when we finish chapter 1 in lecture, you're going to do this. Is that clear?
And the practice is the best out of 2, correct?
No, the practice is unlimited.
Okay,
The quiz is the best out of 2.
okay.
Should we finish chapter 1 by the 8th or the 15th?
I hope we finish it. I hope we finish it between now and next Tuesday.
Okay.
So those are the only 3 assignments due, but like our first 3 assignments is the chapter 1 and then the exercises within the book,
Yes,
the practice and the quiz.
yes. So the only 3 assignments due within the next week and a half to 2 weeks is the chapter 1 smart book assignment, the chapter 1 practice, and the chapter 1 quiz.
Perfect. Thank you. Very
You're
clear.
welcome.
Thank you.
Anything else?
So on September 8th, we have to take the chapter 1 quiz.
That's when it's due. It's open now, but I would wait until we're done with done doing it in lecture.
Okay.
We should finish it by then. And you know what? I will probably, you know what? I'm going to extend that out. It will be due. We won't finish it. Give me 1 second here. I'm actually going to make it due the 15th at midnight, the chapter 1 quiz. So if you give me an hour after class, you're going to see that I've extended that deadline out. Actually, give me 1 moment. I'm going to do it right here. I know you don't see this. This is what I get to see, but I'm just going to extend out this deadline. Make it so let's do the 15th instead.
So the smart book, you're
Yeah.
allowed to get them wrong, but as long as you complete the number of concepts, you have the maximum amount of points, right?
Correct,
Okay.
correct. If that doesn't occur, do you know how to access your grades on D2L?
I think so. And I think when I went through the online virtual orientation, I guess you could call it, there's an app for your phone called Pulse. And then there's also grades that you can like shift it and it'll show you the grade,
Hey, if
your
it,
current
so,
grade.
for example, if you did go through all of, so you can see I just changed that quiz deadline. Right there. So it's now due on the 15th. I don't know why I had it due on the 8th. But if you do the smart book assignment and you complete it and it doesn't give you credit for it, full credit for it, let me know. Because I can go in there and look. Other questions? So we were about, with regards to the chapter 1, I think we weren't that far.
Yeah, we were like right there. Oh, it was like the fourth slide, I think.
Okay. I'm gonna review this a little bit before, because I don't think everyone was able to be in class on Tuesday. So major themes of anatomy and physiology. Anatomy is the study of structures and the relationships among those structures. The first studies of anatomy used dissections. More recent studies use imaging techniques. In lab, you're going to do a lot of dissections, hopefully. However, because dissections usually end up, unless it's in surgery, dissections usually end up with someone dying, or you have to do it on a dead thing. Imaging techniques allow us to image and look at anatomy while someone is still alive. So we like a lot of imaging techniques. Physiology is the study of how the structures function. So anatomy, looking specifically at structure. Physiology is looking at how those structures function. Function is tightly linked with structure. Structure is tightly linked with function. If you change something's structure, you change its function. If you want to change the function of a structure, you alter the structure. A major example of this, or a very good example of this, is the heart shape and its musculature. The muscle around the heart is wrapped around the heart in such a way that when the muscle contracts, the whole volume of the heart shrinks, allowing the blood to be expelled from the heart. If it wasn't set up like that, then the heart would not be an effective pump. There are many techniques that allow us to look at structures without having to perform dissections. And this has greatly accelerated the progress of health sciences. Radiography, or X-rays, were discovered in 1885. X-rays pass through soft tissues of the body and project onto a photographic film to produce dark images or negatives. The dense structures absorb the X-rays and appear white on a negative. So dense structures like the bones are going to absorb the X-rays. And because they absorb the X-rays, they won't appear as being dark on the photographic film. They'll look white. Bear with me here for a second. I'll show an example of this. Actually, why did I do that? Give me one moment. Apologize. Hmm. You'd be using caps locks. So x-rays projected at a person. Whatever parts of the body that actually absorb the x-rays will look white on the photographic film because they were absorbed by the person. So when x-rays are absorbed, they're not going to make it to the photographic film, and therefore the photographic film looks dark. I'll say, wait, let me say it like, oh shoot, let me say this differently. The x-rays aimed at the person, whatever absorbs the x-rays, whatever, usually the bones absorb the x-rays, or a heavy metal absorbs the x-rays, that part on the film is going to look white. If the x-rays are not absorbed by a structure in the body, that part on the film is going to look black. So x-rays are really good for visualizing and being able to see structures that absorb x-rays, like bones. Is that clear?
Yes.
So a dense structure that absorbs the x-rays appears white on a negative, the dark image. Places like sinuses here, are not going to absorb because they're just air pockets, and air pockets don't absorb x-rays. Your nose, that's predominantly cartilage, doesn't absorb x-rays. So a little bit, you see there's a little bit of a white there, but overall, you're not going to absorb x-rays by cartilage doesn't absorb x-rays. So that's why it doesn't look bright white right here. Hollow organs, we can use x-rays to show the structures of hollow organs like blood vessels. This is the aorta. Here's the heart right here. Here's the aorta. Down below here is the carotid artery coming into the brain. We can use x-rays to study hollow organs by filling those hollow organs like blood vessels up with a heavy metal that can absorb the X-rays. Actually, bear with me just for a second here. I'm saying the wrong thing here. No, I'm correct. I'm correct. But let me say something different about this photo. The other way that you produce these photos of hollow images is you can take pictures, putting a dark contrasting medium, filling that vessel full of a very contrast medium, taking a picture of that medium in that vessel and subtracting out all the background. So that all the other background appears white. This is often how many aneurysms are, which is a weakening of a blood vessel, are detected. This is often how a blockage or a narrowing of a blood vessel is shown and demonstrated. If you've ever heard of someone going in for a triple bypass on their heart, what that is because there's been a narrowing of the blood vessels around the heart, and they need to go in and reconnect some of the vessels. And in that case, reconnect 3. The way that they detect the narrowing of the blood vessels is through angiography. Angio means vessel, ography means picture. Digital subtraction means subtracting all the background except for the vessel pictures, what you're looking at with the vessel. Any questions about this? Sonography is the second and oldest, most widely used method of imaging. Sonography is also called an ultrasound. This is where mechanics, such as a handheld device, is pressed against the skin to produce high frequency sounds waves. Those sound waves echo back from internal organs that they bounce off, like a developing baby. Or like in my cat, I don't know if you can see that my camera is bumping a little bit there for a moment. My cat is busy kneading his face up against my monitor, like right now.
What's your cat's name?
My cat's name is Leo. He's one
Aw.
of 3. Come here, buddy. Come here and say hi. We know you want to. Oh, come here. Just
Oh, he's handsome.
say hi.
Oh, hi,
He
Leo.
does. I'm kind of a cranky pants, except when I'm with my mom, and then I'm a nice cat. Yeah, I know. And the reason I brought him into this picture was because he's had an ultrasound done, and that ultrasound actually showed that he had a thickening of his intestinal tract. And that was kind of a big deal, and we'll talk about this later in the semester. But that was kind of a big deal because he was not absorbing nutrients. And what he was doing was showing all the signs of being anorexic while eating all the time. And so the ultrasound actually showed that he had a thickening of his intestinal walls. And so he wasn't able to absorb nutrients, so he was digesting away all his muscles to maintain life. And that was about a year and 4 months ago. And so now he's a very happy 14 pounds. And he's on a very special diet. But that was the way it was actually diagnosed, was through an ultrasound. Being able to look at the thickness of the vessel, the intestinal wall and the intestinal tissue.
Would echocardiogram go under ultrasound
Yep.
when they give you an echo?
I think so. I'm not positive about that, but I think so. Are you talking about an ECG?
Not an EKG with the leads. I think it's an echo where it's the same thing. Like they rub petroleum jelly all over
Yep,
you and they
it
just kind
is.
of see.
It has to be, yes. So benefits of ultrasounds is they don't use harmful X-rays. It allows you to view tissues in motion. That doesn't work so well with an X-ray. A CT scan or a CAT scan, previously called a CAT scan, computed tomography, is useful for detecting things like tumors, another way of detecting aneurysms, cerebral hemorrhages, meaning a breaking of an aneurysm, or breaking of a blood vessel, rupturing of a blood vessel, and kidney stones. It is very similar to an X-ray, your typical X-ray. It's just a modified X-ray. In that normally if you get an X-ray, my brother broke his foot a couple weeks ago, several weeks ago at this point. And my guess is he put his foot down on something very gently, and they had a photographic film on the other side of the foot. They aimed X-rays at his foot. Whatever absorbed the X-rays showed up white on the film. The difference between a typical X-ray and a CT scan is that the CT scan has an X-rays that are being aimed at the individual, but in a spinning tube. So you lay inside a tube, and then the tube spins around you, aiming X-rays at you at a photographic film on the other side. And it spins around your whole body, or the person's whole body, which allows doctors and healthcare providers to get 3D cross-section images of the body, section by section from head to toe. For example, here in this particular CT scan image, here's your liver. This is a cross section through the abdomen. Here's the liver. There's the kidneys right here. Here's the vertebral column. This particular one, I'm guessing, looking at that image, that's a hemorrhage, or possibly a tumor. I'm not positive about that one. All that white mass right there, let me re-say this one more way. Oh, you know what? I'm not even gonna try to guess. It's either a tumor or a hemorrhage. Because something in there is either growing or it leaked in the brain, and then it hardened, and then it can be, the x-rays can be absorbed by it, and therefore it appears white. That's why the vertebral column here appears white. So this uses low intensity x-rays and produces slice type images. And the benefit of it is that there's an increased sharpness of images compared to x-rays. However, it also takes a lot longer to do it. If you've ever had a CT scan on a child done, they'll knock them under. Not knock them under, put them under, because they can't move during this process. And you can understand why that might be a little traumatic to be inserted into a tube. But it also produces really clear 3D images and allows for very clear cross-section images. MRI scans are better than CT scans for visualizing soft tissues. MRI's magnetic resonance imaging is putting whatever you're trying to visualize in a magnetic field, creating a magnetic field around it. And what it specifically is aimed is at the hydrogen atoms within those structures. What structure, and I'm well aware that a lot of you have not had a lot of chemistry, but what structure do you think contains more hydrogen than most structures?
Like air spaces, probably, like stomach.
Sometimes air, but air is more oxygen. What about water? It's, Leo, you can't be right there. No. What? So it specifically is looking at water.
Would that be blood?
Blood? Yes. Blood and anything. The brain contains a lot of water. Bones don't tend to contain a lot of water. They're more hard compact with a lot less water. So MRIs are much better at visualizing soft tissues. If we look at an MRI, and this isn't a really great picture of an MRI, let me do this. Leo, you can't be right there. No. If you look right here, I want, let's see here. I want just one really good MRI image. Bear with me just for a second here. Okay, if you look right here, one second. That's not a really good one. Right here. Oh, really? Come on. Let's look at this. they've kind of whitened in the color of the skull there. But this is an MRI looking at the brain. You can, what it does is, because MRIs are very good at doing a lot at making water-like structures, things that are full of water, very visible, but not bones, because bones are not, they don't contain as much water. I'll give you another one. That allows us to look through bones and look at the brain using an MRI. So it essentially allows you to bypass the bone, the skull, and look right through it at the brain. It works the same way for other parts of the body. If you imagine your rib cage and your heart, you want to be able to look through the ribs at the heart. So you would use an MRI, because you don't want to have your vision or your image impeded by the fact that you have the ribs right there. Is that clear?
Yes.
So varying levels of energy are given off by the hydrogen atoms in this magnetic field. And that energy levels are used by the computer to produce the image observed. It's best for visualizing soft tissues because soft tissues contain the largest amount of water. And we'll talk more specifically about atoms and so forth in the next chapter. PET scans, positron emission tomography, is used to assess the metabolic state of a tissue. For example, a heart attack or cancer. What occurs here is you inject a radioactively labeled metabolite, like glucose, something that's easily metabolized by the body, and determine by how much radioactivity is emitted by a structure in the body, which structures are most active at any given moment. So we use metabolic activity to say how active a particular structure is. So if we inject someone with glucose that's radioactively labeled, places in the body that contain the most amount of activity at that moment will emit the most amount of radioactivity by the breakdown of that labeled glucose. This is then detected by a sensor and analyzed by a computer, and the images show which tissues are using the most glucose at that moment. So this is mainly when you want to see what's most radioactively active at that moment, what's most active. For example, looking at this scan right here, this is looking at a brain. A normal brain with this little area right here, which we'll talk about in a few months here, 2 months, is called the substantia nigra. And it is, bear with me just for a second here, as my cat is trying to cause chaos. because I'm not paying attention to him. Substantia nigra is a structure that's heavily involved in maintaining normal movement. In Parkinson's disease, it is degraded. So in a normal brain, it shows a fairly high amount of activity. In someone with Parkinson's disease, its metabolic activities are highly decreased, or very much decreased. So it allows you to look at determine which tissues are most active at any moment. So what structures are better seen by an MRI than an X-ray?
MRI is soft tissue, as where an X-ray is bones.
Mm-hmm.
The MRI doesn't include radiation though, but the
Right.
X-ray does.
Yes. What tissues are better seen by an X-ray than a PET scan?
Denser objects like bones are better seen in an X-ray, and the PET scan is more for the metabolic state.
Correct. Correct. So, bones are pretty active, but they're not as active as other tissues can be. We'll talk about that in a few weeks here. Bones, they, for what we think that they don't do a whole lot, but they do an exceptional amount, but not in comparison to other tissues that can be more active than bone. Ellen is pregnant and she tells Janet, one of her coworkers, that she is scheduled to get a fetal sonogram. Remember that a sonogram is the same as an ultrasound. Janet expresses alarm and warns Ellen about the danger of exposing a fetus to X-rays. Is Janet's concern warranted?
No.
No,
Why not?
'cause the sonogram is used of pressing the handheld monitor and uses the waves and the echoes of internal things to figure out the picture.
So it's using high frequency sound waves, but not X-rays. Correct. Good job, Caitlin. Okay. So that if you remember, we talked about what that complementarity was. The structure of a part of the body allows for the performance of certain order functions. For example, the bones of the skull are heavy, they're stiff, they're strong, because they provide protection for the brain. We have really thin air sacs of the lungs that permit movement of gases like oxygen and carbon dioxide. It allows for easy diffusion. The thinner something is, the easier it is to diffuse through that substance. So this is a complementarity thing, where the structure of a particular body part allows for the performance of certain functions. If something happens to that structure, the function may be impaired. If you've ever heard of osteogenesis, we'll talk about this when we talk about bones in particular, but osteogenic imperfecta. What that is essentially is fragile bones. And I think I may not be saying the word perfectly. Osteogenesis imperfecta. Maybe I am. And what is the result is that people with osteogenesis imperfecta, and there's a wide range of it, but they get their bones broken a lot easier than other people. So if you've ever seen someone get a bone broken from something that would normally not break a bone, like mainly in children, because this is when some of this is observed, their bones aren't as strong as they should be. They're not as hard as they should be. So their function is impeded. Another one is osteoporosis. The bone isn't as thick as it should be. It's not got the calcium is not absorbed the way it should be. And so their bones people with osteoporosis, their bones tend to break a lot easier. So structure is very important to function. It essentially dictates what the function is going to be and how the function will be. What are some other examples of this kind of complementarity where structure relies on function? Do you know of?
Could it be as like simple as movement?
Yeah, I was going to say maybe how the knee is built.
Right. Like, what if you have ligaments that stabilize your knee, right?
Yes.
What happens if you lose one of those ligaments?
You're injured or you can't do what you're supposed to do.
Right, and your movement is impeded or unstable.
So would that be in a sense like, I don't know, say for instance, like a sport injury and you tear a ligament, like would that be the breakage of a complementary thing?
Right, if you think I will, in a later chapter, we'll talk about this, but my little niece, she's not so little, she's 13, but she this summer decided to put her finger through a glass pane window. I say she decided to do it. I don't think she intentionally did it, but she ended up slicing a major ligament in her finger.
Yeah.
And ended up having surgery actually about 48 hours later.
Wow.
And they say that by Thanksgiving, she should have normal functioning of her finger back, maybe. But what that is so she sliced the ligament. I'm going to unshare just for a second here. She sliced the ligament about right. I'm trying to remember about where it was, about right here. About right here. And I'll show you the pictures later. They're not really gory, but they are a little. So she sliced it about right here. And the major reason she knew that she'd sliced a tendon was because she could not flex the distal end or the most distal end of her finger. She couldn't flex this part. She knew, her parents knew pretty fast that she had probably cut a tendon. So she ruined this. So she cut the structure of that tendon, which obliterated the function of that tendon. I honestly, and she's not as excited about this, but when I heard that she did that, my first thought was, geez. And then my second thought, because I like anatomy and physiology, is okay, that's cool. Let me figure out what you did. And she wasn't really excited about it, but I was. But I did tell her that she should really stop doing some of the high risk, high adventure stuff she's doing, like putting her fingers through class panes. How does one assess certain aspects of body structure and function? The first one is inspection, just looking at the appearance. For example, the presence of a rash. The second one is palpation, being able to gently touch the body surfaces with hands, being able to feel the pulse and determine pulse rate. One thing that I'll show to you, and you have Joel Bacon for who do you have for lab? Is it Joel Bacon?
Yeah, we have Joel Bacon.
Don't tell him that I'm going to show you this, because he'll probably come back to me and say, Mary, what are you showing your students?
It's fine. We haven't met him yet, so.
Okay, well, don't tell him even when you start talking about blood vessels, don't tell him that I'm doing this. So if you right here, here's your sternum right here. Here's your manubrium right here. Right behind it, if you put your finger down there, don't do it on someone else because you can possibly hurt them. But do it only on yourself. Put your finger down there and you got to press fairly hard. That's why you're only going to do it on yourself. And then don't talk for a second. Do you feel a pulse?
Yes.
Why do you feel a pulse there? Because your aorta is right underneath there.
Oh.
Yeah, when he asks you about that, say that we never did it, because he's had a lot more teaching experience with hack than I have, so I don't want to get myself in trouble. But so the palpation, being able to feel a pulse. Auscultation, or I think that's how you say it, auscultation. Listening to body sounds to evaluate the functioning of certain organs. Listening, for example, listening to the lungs or heart using a stethoscope. Can also listen to stomach sounds. Percussion, tapping on the body surface with fingertips and listening for resulting echo. Another way that we can look at certain aspects of body structure, cadaver dissection, cutting and separating human body tissues to reveal tissue relationships. The next one is comparative anatomy, being able to study the multiple species to learn about form and function and evolution. This summer, I did a science day with my brother's kids, the same little girl that put her finger through a glass pane. I was doing a science day with her siblings, and we got some fixed frogs. And I was busy trying to look for the trachea in a frog. Oh, was it a trachea? Yeah, I was trying to find the trachea in a frog. Guess what? They don't have a trachea. I've always been, you know, I've done it on fetal pigs. I can find a trachea in fetal pigs. I can do it on rats. But I kept looking for a trachea, and finally my sister-in-law Googled it, and they don't have a trachea because they don't have a neck. So when you want to learn about form and function and evolution, that's an example. The one other thing here, the reason I showed these two particular pictures, this is the heart in the human. This is the heart in the earthworm. They have 6 hearts that work in a contractual manner. I think how I think it works is that it works in kind of a spiral contraction. Another way to assess aspects of body structure is exploratory surgery. Opening the body and taking a look inside to see what's wrong or what can be done about it. There it looks like they're seeing a blockage in the intestines. And then medical imaging, being able to view the inside of the body without surgery. Sometimes they do medical imaging to figure out what they need to look for in surgery. That DSA, that means that digital subtraction angiography. Some other ways we can use microscopic examination of tissues. So histopathology. Histology is tissue study. Histopathology, looking for disease tissue or looking for disease in tissue. Cytology, the study of structure and function of cells. So cytology, looking at cyto means specifically cell. So looking at the function of cells. Ultrastructure, using electron microscopy. She'll talk about hopefully more in lab. Any questions? Gross anatomy. Dissections, it's the study of structures that can be seen with the naked eye. I should have put this slide in front of the other one. But gross anatomy and then histology, looking at this examination of tissues with a microscope. Too far. Someone else has a cat there too. Sarah, I can see your cat. Okay. So what method would be used for each of the following? Listening to a patient for a heart murmur.
Auscultation.
Auscultation, correct. Studying the microscopic structure of the liver.
Would be that cytology or cystology?
Say it one more time.
Cytology.
What about histology?
Histology.
Yeah, it would be more like histology. I'm trying to think if it could be, you know what, it could be both. It could, I think it's both.
Is the first one auscultation?
Yes. Examining liver tissue for signs of hepatitis, which is inflammation of the liver.
That would be
Histopathology.
Histopathology, correct. Learning the blood vessels of a cadaver.
Isn't that
Dissection.
exploratory?
Yep, or dissection. Yes. Performing breast self-examination.
outpatient.
Outpatient.
Correct. Within the body, there is a hierarchy of complexity. And with this hierarchy of complexity, emergent properties come out on as things become more complex. So for example, the body starts, we are really, our body structure is composed of atoms. Atoms are the elements, chemical elements that then bind with other atoms to become molecules. Molecules then start interacting with other molecules to form organelles. Organelles come and begin to interact with one another to form cells. Cells are the smallest unit of an organism that can carry out all the basic functions of life. Cells come together and interact to form tissues. Tissues interact to form organs. Organs interact to perform specific functions in organ systems. And organisms are made of multiple organ systems working together. So at each step along this process of molecules becoming macroorganelles and organelles becoming cells and cells becoming tissues, at each time that there's this changing complexity and things become a little bit more complex, things start interacting with each other to become a little bit more complex. At each level of this complexity, there's properties that emerge that weren't there before. This is what we call evolution. How things tend to evolve. They start as things interact with one another, they become more and more integrated. And as they become more integrated, they develop functions that emerge that weren't there before. Properties that are now present that weren't there before. So we have an interrelationship among organs that are parts of organ systems. That are going to interact with one another. So the digestive system interacts with the cardiovascular system to allow for the absorption of nutrients. cardiovascular and to eliminate waste, digestive system. The cardiovascular system interacts with the respiratory system in addition to the digestive system to allow for the uptake of oxygen and the elimination of carbon dioxide. Kidneys interact with the cardiovascular system to eliminate waste from the blood that can then be excreted as urine. Nutrients and waste interact and move in between in the blood within the cardiovascular system to allow nutrients to be taken up and waste to be eliminated.
Question.
So
This might be far-fetched,
No,
but
go ahead.
for complementary, back to that, would it be crazy to say that like the integumentary system is complementary to all the other systems in the body?
Well, if we didn't have it, let me say it this way, its structure, if we didn't, if this integumentary system didn't have the structure it has,
Mhm.
all the other systems would fail. When in lab, when you talk about the integumentary system, one of the key functions of the integumentary system, which she's talking about the skin,
Mhm.
is that
It protects.
it protects, but it protects you against dehydration.
Okay.
And if you are, one of the major risks of getting burned, the predominant risk that they worry about is dehydration. Infection is next. But if you lose the water in your body, you lose any exchange between almost all organ systems.
So is it safe to say that, or would you kind of veer away from saying that?
I
it's
would probably
complementary?
veer away from saying it,
Okay.
but at the same time, if the cells of the integumentary system lose their ability, lose their structures, the keratin that allows them to be water resistant and maintain the water within the body. If you lose that keratin, you lose the function of the integumentary system. You lose this, you lose the keratin. That's going to change the structure of the skin, which is going to decrease its ability to prevent dehydration. And because the integumentary system interacts and protects all these other systems, all these other systems, working with a new computer to me. If you lose that ability to protect the other systems from dehydration, all of the other systems are going to collapse. So we have about 5 more minutes. Let me go for another 3 minutes. Go through these questions. Which of these is the correct representation of the hierarchy of biological organization from least to most complex?
Would that be C?
C.
C?
Yeah.
C, B is in Bravo or C is in Charlie?
C as
C
in
as in
Charlie.
Charlie.
You're correct. So the molecule becomes the organelle. The organelles interact to become and form cells. Cells interact to form tissues, correct. Atoms and molecules are part of which level of organization in the human body?
B.
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 I think it's A.
Chemical.
Yeah.
It's A, it's chemicals.
Why is it chemical?
Because the molecules have to coincide with the organelles and the organelles make the cell.
Correct. A structure made up of two or more types of tissues that perform a specific set of functions is what level of organization?
D, organ.
D.
An organ.
Correct. All right, this is where we're gonna end, is right here. What this is we often use these functions concepts maps to show a hierarchy of complexity. If you look here, these are all of these spaces right here are the different organ systems of the body that you'll talk about in lab. They can interact with one another and they have their own parts. Digestive system breaks down. It includes the stomach and possibly, I'm going to say that would be the intestines. It breaks down nutrients that can be absorbed. Circulatory system functions in circulating the blood, includes the heart and the blood vessels. The nutrients absorbed in the digestive tract are absorbed into the blood vessels. Let's give another example. The integumentary system up here. Integumentary system functions in protecting tissues and, let's say, dehydration. It includes skin and sweat glands. The blank system includes the bones, skeletal system. And what else does it include? It includes ligaments and cart tendons. We are going to end right there. Are there any questions?
So the homework is just to do the assignments in the
Yeah, work on the
in-
chapter 1 practice, work on the smart book assignment. Let's finish this chapter. We'll finish it when we meet next Tuesday, and we'll start the second chapter. But let's finish this chapter and then take the chapter 1 quiz. Have a
All right.
wonderful weekend, okay?
You too.
Thank you.
Thank
Thank
you.
you.
Thank you.
Bye.
Bye-bye.
Hi.
Bye. Carrington, are you still there?
Yeah,
Carrington,
I'm here.
hi.
Hi. Am I in the wrong? I don't know what's going on here.
You're in the right room, but the class is over.
Oh, see ya.
See you later.
Bye.
Bye-bye.